Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and we've got, a new Healthline today with a new guest, so I'm happy to introduce you. You met Dr. Jarvis last month, but today you get to meet Dr. Meredith Patton, and you both are with Restoration Dental Group. Thanks for being here.
Oh, excited to be here.
Very excited, to be back.
Absolutely. So we've got our little, what, does he have a name? He have a name?
We should have come up with a
we
name for it.
Right.
We'll have one for next time.
Right.
Yeah. This is our intraoral scanner. It kind of replaces the old-fashioned impression material. This takes a digital impression of people's teeth, and we use it for various things. We're going to show you today how that helps us take care of you.
Okay, so I get to pretend to be a patient today.
Sure.
Maybe. Okay, that sounds good. Okay, I'm actually due for a cleaning, so this works out perfect. So you guys are at Restoration Dental Group, and Meredith, you mentioned in our midday newscast you've been with the group for about 2.5 years.
I have, yes.
Right.
I actually grew up in Shreveport, and I was a patient.
Cool.
Dr. Jarvis was actually my dentist before I became a dentist, so he's done a filling on me. He does great work. So
I still remember that day. It's funny.
Oh,
yeah,
that's so cool.
We go way back.
That's awesome. Okay, and are you guys the main dentist at Restoration Dental?
We're the two dentists, and then we have 3 hygienists, actually 4 that works part-time, and various other team members, so yeah.
Very cool. Okay, and remind us how long you've been practicing, Dr. Jarvis.
So I've been out of school about 15 years, and came right back to Shreveport after dental school.
Nice. Are you from Shreveport, Dr. Patton?
I am.
Yeah.
I grew up here, so a lot of the patients that I inherited when I joined are people I already knew and people in the community, so it's really a great place to work.
Yeah, and I'm sure you get to know your patients. You kind of watch them grow up. If you have, children that come to see you, and you watch them grow and get to know them, so that's really cool.
It's been a lot of fun. Some of the kids I started seeing right off when they were 4 or 5 are now graduating high school, going to college. So it's been a lot of fun seeing those families kind of grow, and part of the fun of being a healthcare provider in a place like Shreveport. Yep.
All right. Okay, so you not only do cleanings, but you also you use a lot of technology in your practice. Obviously, we've got this guy right here next to me, and so with the new technology, how are you using and implementing this into your practice?
We've been using something similar to this, I guess maybe 10 or 11 years. This is our second version that we've invested in, and it's always been important for me to provide the top level of care and technology that dentistry provides for the people of Shreveport. And so this is a way, if anyone's ever had braces in the past or had a crown, you remember getting the impression taken with a goopy impression material that you had to bite into. Sometimes it doesn't taste very good, or it can gag the patients, which is never easy, but sometimes was a necessity. And luckily this has been in development for a long time, and now that the computers are so powerful, in a computer this size, we're able to do some really fantastic things with this. As far as we can use it to help diagnose patients and educate them. I know Dr. Patton had a patient recently that really helped with that.
Absolutely. Yeah, so typically if a patient comes in, they haven't seen a dentist in a long time, they don't know what work needs to be done, and there's several options that we could go towards. We'll get the scanner in, it'll take 5 minutes, have a great assistant that will scan the patient up, and then I have a chance to look at his teeth and his mouth and really think about what the best option is for him, and bring him back, and he can actually see his teeth the way that I see them. And so it's much easier to explain why you need a filling here, why you need a crown, or this tooth needs to come out for this reason. It's a really great educational tool and a diagnostic tool, so we use it all the time. It's really great.
So you have these probably in every exam room, or is it?
We have one, and so we can wheel this around to all of our different operatories. And so we try to manage our schedule to where we only maybe need 1 or 2 patients at a time that we may use this on. So we don't have to use this on every patient. Not everybody needs to have a scan done. So, but we kind of manage our schedule to where we can wheel this around the office pretty easily. Yeah.
So you mentioned the goop that you used. Is that how you refer to it? Yeah, I remember that well.
One word is alginate is I guess one word, and then there's another material that we use for crowns. It's a big long chemical. I won't be that nerdy today.
It's okay if you were. I wouldn't be able to repeat it, but that's okay. So this is kind of replacing that. right? So you maybe hardly ever use the goop or the...
Every once in a while, depends
Okay.
on what we're doing. Maybe 95% of the time we're using this.
Okay.
Yeah. Well, I'll show you how it works
Yeah,
real
let's
quick,
go
and then
ahead.
we can expand on here. So I pulled up a Jane Doe patient, and so from starting off, you can tell the computer different things that you want to scan for, whether it's right now I just have it to maybe make a copy of her teeth, and we can print this out. I actually just got a 3D printer installed,
Cool.
finished up today, so we can start printing out different things, and we can talk about that too.
Yep.
But yeah, if you can tell it, if we're going to do a crown, you can tell it that, or right now we're just going to make a copy of, say this is this patient's teeth.
Okay.
All right. All right, and so this shows us the screen where we can take an impression or a digital scan. And so this is basically like a fancy camera, and it's
Right.
taking two-dimensional pictures. That's what all these flashes are. And so what it does is it takes all of these pictures, and then
Look
as
at
you're going
that.
along, you can see sometimes it gets out of focus, and then you got to go back to where it can re-grab it.
So this is the camera that you're picking
So
up.
that's the
Okay.
camera, okay? And so this is making a 3D image of your teeth. And you can go around, and again, doesn't gag the patient. It's very comfortable, it's very fast. You
Wow.
know, I don't know, was that 30 seconds or less? I don't know.
Yeah, and you
then,
have to hold that goop on there for
for a minute,
Yes,
or
yes.
for the more accurate materials, it's 3 minutes or longer. And so from this, I can show the patient what they have going on. Say, for instance, somebody broke a tooth. That's probably the most common thing. Someone
Okay.
breaks a tooth from chewing on something, or there's a large filling. I can say, you can really see where it's broken. Of course, this one doesn't have that because it's just a little model, but
Right.
they can really see. You can zoom in and show them all this really crazy detail that this can show.
Can you show, like, for example, if somebody has a cavity, can you see the...
Sometimes you
sometimes?
can. A lot of times, yeah, if it's a cavitated lesion on a tooth where there's a hole there, certainly people can feel that with their tongue, but then you can really kind of see it in there. Sometimes you do have to only see a cavity on an x-ray, which is
Right, okay.
sometimes too. So, but yeah, sometimes you can see fracture lines on there. Also, and another thing you can do, say, is take a picture of a tooth. Say a patient did break a tooth, and you wanted to just take a picture of it to show the patient. It's not wanting to work today.
That's okay.
You can do it like that.
Okay.
So you can take
yeah.
a picture there. Oh, it did. And then
pull it up and
pull it up and show them. Say, hey, so this is a little broken part. This is what we're going to do. And then from there, you can go through and. Sometimes we send this scan to a dental lab to make different things, and but most of the time we're lucky enough to have this scanner and also what's called a milling unit in the office where we can make a lot of our crowns the same day that we prepare the tooth, which saves a lot of time.
Very cool. Yeah. So do you feel like this is improving, accuracy or precision when you are helping patients? Like you really kind of know in a better way, or like it's maybe improved patient experience as well?
Definitely.
Too?
So one thing I love about doing it this way is just in dentistry when you're treating patients and making a crown or a veneer, you want to be as exact as possible. And so every step of the way there can be a margin of error. And so if you take an old-fashioned impression and that gets sent to a dental lab, and then they pour it up in dental stone, there's a lot of more chances to be 1/10 of a millimeter off or less, and that can make a big difference on a crown.
Yeah.
And so this way, it's a direct image of the tooth, and we can very digitally, accurately design things. And our milling unit mills the crowns and restorations to a very fine, to the micron accuracy. It's pretty remarkable what can be done these days. So,
I know. Wow, technology is so cool, and I love that we're able to, utilize that for sure. Well, we have our phone lines open right now. You can give us a call at 318-219-4569, especially if you have a question related to dentistry or teeth, anything under the spectrum. These are the experts that you'd want to ask. So give us a call. That number is right there on your screen. Okay, so it's improved patient experience, but it's also maybe improved like procedural outcomes. Like, so if you were to have maybe to fix like a broken tooth, I don't really know what the procedure is for that, but I'm sure it improves that as well.
What would you say, Meredith? I could say a few things, but yeah.
Absolutely. Yes. Well, as dentists, we can kind of be control freaks a little bit, and so it's really nice for us to prepare the tooth, treat the tooth, scan it, and design the crown ourselves. So we can have a lot of control on the outcome of what our patients get, the product that they get. And so it is really nice to have a scanning machine, and like Ray was saying, an actual milling machine, which means that, like yesterday, I had a patient, he came in, he broke a tooth. We prepared it, scanned it, made the crown, and he was out within 2 hours.
Nice.
And so he doesn't have to come back with a temporary, he doesn't have to come back to get his final crown in 3 weeks and maybe lose his temporary, you know, eating Christmas candy or something like that. So patient care and the quality of care, I think, improves with our technology.
Especially this time of year when, you know, most people are going to be off. We're going to be off for part of Christmas, and so coming up to the new year, you break a tooth, can be tough to get back in to get it fixed, and so it kind of streamlines the process. You don't have to come back and get numbed up again. Most of the time, you don't have to get numbed up one time, which is kind of not a comfortable thing to go through. So we try to minimize the number of times you have to do that. So
yes, well, we have our first caller today. Justin, thanks for joining us. And what is your question?
Yes, I had a question.
Go ahead.
I got one tooth in the front that's already out, and the other one, well, it was loose for about a year or two.
Yeah.
The other one next to it, now it's loose.
Right. So you want to kind of know your options?
Right.
Yeah.
I'm trying to go ahead and get a piece put in there. So do I need to wait till it falls out, or?
That's a great segue to one of the topics I was going to talk about. But yes, so, you know, it's up to the patients, but yes, I'm fully supportive of being proactive in your dental health and not just waiting for things to fall apart or get worse. And so, no, if you've already lost a tooth, especially a front tooth, and the other one's kind of loose, that's already telling you, you know, we need to get this taken care of. And so a situation like that, definitely. We have some short-term treatments that can get people their front teeth back in the short term. It's kind of like, can be a long-term temporary. Sometimes a loose tooth needs to be extracted. Sometimes we can splint it to the tooth next door to it. But then, yeah, definitely I love getting my patients' front teeth back in place. We can usually do that within a few days, or maybe that day, depending on what all the reasons for the tooth being loose is. And then once we get your teeth back into place with a long-term temporary, we can talk about more permanent solutions kind of down the road. Does that make sense?
Okay.
Yeah. But
yeah, my mama works for Gator Dental.
Yeah, we work with them a lot. They do a great job.
Love them.
Yeah, my mom works for them, semi-packet.
Yeah, cool. They make a lot of our partial dentures that we make, and a lot of our cosmetic crowns. Some crowns need a dental lab tech to make some specialized staining and coloring, and so yeah, Gator does a great job.
Yeah.
Very cool. Well, thanks, Justin, for joining us and for your question. And if you have a question or a topic that you'd like to talk with our doctors and our experts, talking all about teeth, and and we do have another caller. So thanks for joining us, Stacy. And what is your question?
Hi, I am having some trouble with some real soreness in my jaws, and I don't quite know if I should go to the doctor or to the dentist.
You're going to take this from me, yeah.
How long have you been having this problem?
Well, it really just started about 3 weeks ago, and it's just been really, really sore, especially when I wake up in the mornings, and I think I'm kind of clenching my teeth or grinding my teeth together at night.
Oh, absolutely. Yes. So your pain could be several things, but it does sound like it may be to do with the muscles that help close your jaw. Lots of patients clench and grind their teeth at night, and they have no idea. They wake up and they have a very sore jaw, sore muscles, and so oftentimes they can have broken teeth. This can cause a lot of discomfort, a lot of tenderness. And the nice thing about the technology that we have is we can scan a patient for a custom-made night guard, and oftentimes that is
Cool.
what kind of helps remedy that problem and gets them out of pain. And it's something that's custom-made to fit their exact mouth. It's comfortable. But lots of patients, especially this time of year, can be really stressful. So you take it out on your jaw and your muscles, and
Certainly,
especially when you're sleeping. So it sounds like that may be the issue, but we'd love to see you and check you out.
Yeah, you're not the only one. We have lots of TMJ pain patients, and that could be lots of different things that cause that. So yeah, definitely a dentist would be the right one to start with. I don't know, that'd probably be the best place to start. And we can tell you sometimes it is a medical condition, but usually it has something to do with your teeth or clenching and grinding, and there's lots of different things we can help you with for sure.
Yeah, I had TMJ.
Okay.
It's such a common thing. It seems like the past number of years we're seeing more and more patients with those issues. So.
Right. Well, thanks, Stacy, for your call. And I know that's a common, condition, as you mentioned. So I actually had 2 sets of braces growing up, and I think my dentist said that it could have contributed to maybe TMJ pain.
Definitely.
And
Yes.
of course just stress in general. I remember right before I got married and I was so stressed out, I had the worst pain. Oh my goodness.
Oh.
So yeah. Anyways, okay, we do
We'll
have
go back to
another
that.
caller.
That's a great talk to you.
Yes, thanks Mark for joining us. And what is your question for our doctors?
Yes, hello, how are you all?
Well, great.
Hi, great.
I have a question. As one ages, if you're in your 70s and you're starting to experience the receding gum line, what can one do to prevent it from getting worse? And then if it should get worse, what are the treatments for that?
Yeah, that's also a very common thing, especially patients that are getting a little bit older and have been using their teeth for a long time. I always remind patients that, you got these teeth in your early years, teenage, 10-year-old years, and so you've been using these teeth for 60 years now. A lot can happen. So receding gum lines or gingival recession can be related to what's called periodontal disease. That can be what's going on, where the bone actually that holds your teeth in can be receding away because of different calculus buildup, or sometimes a genetic predisposition, or not routinely getting your teeth cleaned every 6 months for 50 years. That can lead to slowly, I tell people, like, you may only lose like 1/10 of a millimeter of bone loss or gingival recession a year, but extrapolate that over 30 years, that's 3 millimeters. That's a mile in dentistry. And so definitely with gingival recession, we certainly want to try to stop it where it's at. And it usually requires first, evaluating on x-rays and see what all is causing it, and then eliminating those causes by either a deep cleaning or scaling and root planing sometimes is required. And if we can get your gingiva healthy, sometimes we certainly refer to a dentist called a periodontist. We have some great periodontists in town. They specialize in treating gum disease like you're describing, and they have different grafting procedures where they can add gingival tissue if they can. And so definitely it's just a matter of getting a diagnosis from a dentist and then coming up with a plan. And usually you can stop it where it's at. Sometimes it does lead, if like the previous caller talked about his teeth were getting loose, that's certainly what this can lead to. And then a decision is made, do we need to replace the teeth with a prosthetic or maintain you where you're at?
Gotcha.
Does that make sense?
Yeah. But, so it's just the cleaning then is what you're saying is.
That'd be a start. Yeah, that'd be a
most
start.
Most preventative, which I've been doing that. I think it's just 70 years of wear.
Then it probably is. Yeah, and also clenching and grinding can cause it. Yeah.
Is it considered normal to a point, as senior citizens, I guess, but what do you do to stop it from getting worse? And you're telling me it's cleaning, I guess.
It's
Is
that
correct?
also too, like we just talked about, people that clench and grind their teeth, that can cause recession. Interestingly enough, when you put that much pressure on your teeth and the bone around it, sometimes you lose bone and then your gum recedes. And so getting a night guard can sometimes prevent that. But like you said, there's just multifactorial, lots of different things. But yeah, definitely, if you've been routinely getting your teeth cleaned, then it may just be a matter of seeing a periodontist to see if they can graft those areas to raise your gum lines back up. Sometimes that's not an option. A lot of times it is.
Thank you.
Yeah.
Very interesting stuff that we've hit rapid fire had in just the last couple of minutes. Yeah, I love it too. Yeah, so if you're just joining us and you have a question for our dentist in studio today, give us a call, 318-219-4569. So it brings up a good point too, so you mentioned that you can create a night guard using this computer, I guess
device,
is what
yeah, for
device
sure.
that we're calling it.
Absolutely.
Yeah, so tell me about that. Like, and that's probably just all the more reason to maybe go see a dentist, you know, following up with one routinely, just so, you know, you can be preventative and catch things early. So it's
Absolutely.
not going to cause, you know,
Yeah, definitely.
strife.
And so you'd be surprised. We have so many patients that grind their teeth and have worn their teeth down, and they don't believe us when we tell them, like, you're grinding your teeth. Oh no, there's no way. I don't grind my teeth. There's no way. And so this, you know, we can take a scan of their teeth and show you. See these flat areas on your teeth?
Wow.
That's where you're grinding your teeth down. And so yeah, definitely. We can take a scan of your teeth and then digitally design the night guard or a splint, depending on what symptoms patients have. Sometimes they just need their teeth protected from each other. If they're not having TMJ pain or anything else, they just need a piece of plastic in there to kind of be simple to keep your teeth from grinding across each other.
Yeah.
And so yeah, we can design that on here. Like I said, I also just installed a 3D printer. We can print those in the office now and get them to the patients in a short period of time.
Is that the milling machine that you're talking
Well, so
about? Or is it a little
that's so the
different?
milling machine is a device we cut away from porcelain to make a crown, and
Okay.
then a 3D printer prints from a liquid resin to build
Yes.
bigger things.
So you got 3 different machines.
We got all kinds of stuff.
I love it.
Everything.
Lots of fun toys.
Yeah.
Love it. Well, Roger, thanks for joining us. And what is your question?
My question is, my teeth are in good shape, but it seems like the gums are backing off or shrinking, and I have to brush my teeth very carefully to get all the food out of these pockets below the gum line, our original gum line. Is that a normal thing for gums to recede? I'm only 81 years old, so I'm curious, am I in nature or have I done something wrong?
A young man of 81. I love it. What, you hit?
Yeah, you can repeat
Yeah,
it.
definitely. You know, it's when patients hit a certain age, they do get some recession. And you mentioned food packing. Like packing food between your teeth is very frustrating. When you get a little bit of gum recession and maybe your teeth separate a little bit, we see it in the back teeth a lot of times as patients get older. The back tooth kind of moves backwards a little bit and opens up a little space. So yes, food packing is a very frustrating thing that people deal with. And it is very important to get the food particles out of there as soon as you can, because on an older patient, we see where patients pack food and have some recession. It can cause tooth decay later in life. You know, a lot of teenagers, young people get tooth decay, but then a lot of people later in life start getting tooth decay again that may have never had it in their adult years because of conditions like this. And so, again, it comes down to like seeing the patient in the office and seeing exactly what's causing that. A lot of times it may have to, you may need, like you mentioned, you know the word deep pocket. That's a general term in dentistry where definitely you might need to see a periodontist to do a pocket reduction surgery to get those pockets, actually, I don't use the word cause more recession, but they make that pocket more shallow so things don't collect and makes it easier for you to keep clean. So in your case, it may be more than just getting your teeth clean. You may need a procedure done to eliminate those deep pockets. And so a place to start would be a general dentist, and they could diagnose, say, well, maybe we can treat this here. You may need to see a specialist for that.
Yeah.
We see that all the time. It's very, very, very common. Very normal thing we take care of.
Second question.
Yep.
All right. Second question is, the toothbrush I use, I don't mind scrubbing things to get them clean, but I have been told that I need to use a soft bristle toothbrush rather than a real hard or firm one.
Yeah.
Your
Yes.
opinion.
Hit it.
Yes, we are not fans of hard bristle toothbrushes. They do more damage than good. So what I would encourage you to do is maybe invest in some sort of electric toothbrush that'll do the work for you. Instead of pressing down and scrubbing yourself, let the electric toothbrush do the work. It may feel like it's not doing a good job because you're used to that heavy pressure. And then also with your pockets, you may want to consider buying a water pick. My patients that have that often get food stuck between their teeth and it's hard to reach way in the back, a water pick or a water flosser is really convenient for flushing things out. But I would invest maybe in both of those two products and Oftentimes the electric toothbrushes will now give you some sort of sign or signal if you're pressing too hard. And so that's what we want to discourage. We want gentle pressure and let the toothbrush do the work.
That's a common question. People that are used to using a medium, or I don't even know if they still sell hard toothbrushes, I guess they still do, are used to that like certain feeling and don't think a soft toothbrush gets their teeth quite as clean, when really it does if you do it correctly. So, yep.
Yeah. Okay. Thanks, Roger, for those great questions. I'm
Yeah,
sure
very
they're
good. Very good questions.
Yeah. So you mentioned that you're able to educate people with this device. Is that something that you showing them how to brush their teeth, or maybe how to take care of their teeth
Definitely,
with this?
yeah. Some patients have difficult areas in their mouth that they're missing when they're brushing, and so they don't even realize that a lot of times it's behind the second molars on the top, or the tongue side of those lower teeth. And you can scan their mouth and see how this gum line is receded, or this is really red right there, and that's where you're missing, and kind of educate them for sure.
Very cool.
Yeah. And then also patients that have cracks in their teeth, like someone mentioned, or you can show them visibly on there for sure. So yeah.
Also crowding. We do something called Sure Smile, which is a clear aligning, kind of like Invisalign, but you can show how your teeth are rotated and crowded, and oftentimes those areas are really hard to get clean and can have cavities, and so you can really look at your teeth and see maybe that's a good option for you.
Yeah. And so that helps to reduce the overcrowding. Is that what you're talking? Like it
Right.
will
So
move
it moves
around?
teeth.
Okay.
They're orthodontic aligner trays, and
Okay.
so yeah, they're kind of like Invisalign.
Okay. So what about if someone like lost their retainer that they wear at night or something? Can you make them another one with your 3D printer?
Definitely. If we were the one that made the first one, we can probably save that file. Where we save that file in the computer, and then if they've been wearing it routinely and they had just lost it, we can usually zip another one out pretty quickly. If they need a new impression, it's easy enough just to take a new scan and design one and get it made pretty fast. But yeah, and I was going to share this real quick if we have a few. But say that this is a patient that actually has a set of veneers that broke one, I think, biting down on a fork. And so I'll quickly show, like, this is where a veneer prep looks like. And so this one was fractured. And so you go through and you can design what the tooth should look like. And the computer starts kind of like a artificial intelligent design. It compares the other teeth. And then from there we can talk to the other computer and mill it out. And then so this is what kind of shows the material we make the veneer out of, and it shows what the milling unit's going to do. And it cuts that out and
Cool.
put it in the patient's mouth. So
And it probably, a lot of times when you're talking with patients, it's hard to maybe envision the whole process. So this really gives them the opportunity to see, okay, this is what, it's like less apprehensiveness going into maybe a procedure.
Patient education is like one of the great starting points. Like you want to make sure the patient understands what's going to be going on, what's going to be done to their teeth and why. And then what the end result is going to be. Another thing we can do if someone wants like cosmetic work, veneers, crowns or whatnot, we can show them digitally what the end result's going to be, and then even print out something that they could try it in before we even touch their teeth with any procedure, and you can decide, do you like this or not? Is this going to be a great enough result where you want to invest in? So yeah, there's a lot of things that we can teach the patients what is going to be done and get them more comfortable or excited about what we can do for them.
Very cool. Yeah, so we have just about 90 seconds left. So tell us, where are you guys located? Do you have one or more locations, multiple?
Just one right now.
Okay.
Our office is off of Fern Avenue. It's a great little spot. It's between,
Burt Coons and 70th. It's in
70th.
area called Sand Beach Office Plaza, right down from the Auto Mall, kind of.
Nice, yes, and your address is right there on the screen. So if you want to check them out, there it is. Do you have a phone number that is good to contact you guys?
Sure, yeah. 797-1181. January is a great time to, if you hadn't seen a dentist in a while, start the year off right. It's a great New Year's resolution. I'm going to take care of my teeth now. So.
Absolutely. Yes, never too late to start.
Right.
Right. Okay, so what's your website as well?
It's restorationdental.co. There you can see what all we do and meet some of our other staff that's on there, and you can fill out your new patient forms on our website, and that directly sends it to your chart. And you can also now make payments on there and a lot of things that we can do. Yep.
Yeah, very
We've
easy.
really tried to streamline our new patient intake to make that a more or a less stressful situation where you can fill out your new patient forms beforehand and get ready for your appointment.
All right. Well, I've learned a lot today. Hopefully you have as well. We had some great callers today. And so thanks for coming in, Dr. Jarvis and Dr. Patton, your first
you.
Healthline.
Yeah, that was a lot of fun.
It was fun.
Yes, and device. We're going to come up with a name next time.
Yes.
Well, thanks for joining us. Everything will be on our website at ktbs.com/podcast, especially if you missed it or if you wanted to rewatch it. Thanks for joining us.